Good day, I'm Stephen McHugh, and this is your JIS News for Monday, March 29, 2021. Both houses of Parliament have now approved legislation to implement a fixed penalty ticketing regime, among other measures, to strengthen the enforcement of COVID-19 protocols. After the lower house gave its assent on March 23, the Senate approved the Disaster Risk Management Amendment Act 2021 on Friday. Leader of Government Business in the Senate, Kamina Johnson-Smith, says that in addition to the fixed penalty ticketing regime, authorized officers will be empowered to enforce simple orders in the context of a disaster without having to first give a warning.
To be clear, it is not that an authorized person cannot warn if the circumstances warrant it, but the experience on the ground for our police has been that the obligation to warn has proved impractical for the purposes of not only encouraging compliance, but for prosecuting same, and accordingly are counter to the interests of promoting and securing Jamaica's health and well-being.
The bill specifies 10 levels or tiers of fixed penalties. These range from $3,000 for first-level offenses to $500,000 for offenses at the 10th level. There are 40 offenses specified that attract these fixed penalties. Senator Johnson-Smith says stronger enforcement measures have now become necessary as moral suasion has not worked to this point.
The reality is that people are dying. People are dying. The hospitals are full. It is important that we seek to enhance compliance to reduce the burden placed on them.
Jamaica has now administered nearly half of its first supplies of COVID-19 vaccine, with approximately 30,000 of its 64,000 doses given so far. Minister of Health and Wellness, Dr. Christopher Tufton, gave that update on Thursday after observing the COVID-19 vaccination process in Manchester and St. Elizabeth. While acknowledging a few kinks in the system which continue to be sorted out, he commended public health officers for a seamless vaccination process to date. As it regards news of some vaccine-producing countries holding back shipments for export globally, the health minister admits there is likely to be some delays in receiving supplies, but says government is working to remedy any challenges.
We're cautiously optimistic, but it is more likely that we will see some delays than none at all. The chances of the market becoming a lot more available for vaccines are greatly enhanced, I think, over the next 2 to 3 months, because the countries that are now hoarding are holding back supplies from exports. I think it's a matter of time before they reach a particular point when, either because of vaccine hesitancy, people not taking it, or them exhausting the population that they're targeting, there will be vaccines available for the rest of the world.
Dr. Tufton says it should also be noted that other vaccines are coming on the market in short order.
The WHO are looking at Chinese vaccines, the Sputnik out of Russia, other vaccines. 83 vaccines are under clinical trials now. So I do believe that with every month, you will see more coming on the market, greater production, and more availability.
For now, Jamaica is expecting another shipment of 26,000 doses in early April. But the health minister says it remains most critical for Jamaicans to maintain the COVID-19 safety protocols.
Because frankly speaking, even if we had vaccines now, you wouldn't benefit from the type of herd immunity that we desire as a country. So it is so important that the country recognizes that we have to continue managing the way we have managed over the last year, with the protocols being observed and any other restrictions that the government would have put in place.
Another 50,000 Jamaicans are to benefit from cash grants under government's COVID-19 Allocation of Resources for Employees CARE program in the 2021-2022 fiscal year. Minister without portfolio in the Ministry of Economic Growth and Job Creation, Senator Aubin Hill, says the money is to be provided through the $60 billion Social and Economic Recovery and Vaccine Program for Jamaica, SERVE.
The SERVE fund has $3 billion in it for the continuation of the CARE program and the set cash unemployment support grants that support those who earned below the income tax threshold and have been unemployed as a result of the COVID-19 pandemic from all sectors. And the CARE program's best cash grants that support tourism employment for the quarter April to June 2021.
Senator Hill was piloting the Appropriations Bill 2021 during last Friday's sitting of the Senate. The bill was passed by the Upper House, giving approval for government's estimated expenditure of $830.8 billion for the 2021-2022 financial year. Since its implementation in April last year, approximately 435,000 Jamaicans have benefited under the Overall Care Program, which was established to cushion the economic fallout from the pandemic. Individuals can expect to see reduced operations from the Jamaica Urban Transit Company, JUTC, during the coming Easter weekend and the remaining lockdown periods. JUTC's corporate communication manager, Cecil Toms, says the decision follows government's recent adjustments to the curfew hours to help reduce the spread of COVID-19. He says the company will provide service for essential and frontline staff during those periods and continue providing normal service from 5 a.m. to 8 p.m. on weekdays. Commuters can view the schedules on the JUTC's website at jutc.gov.jm and on its social media pages. Persons may also call JUTC's customer care team at 888-588-2287. And finally, the Ministry of Justice is calling for more persons to volunteer as mentors under its National Child Diversion Program. National Child Diversion consultant Ruth Carey says there are just over 420 mentors in the program, which amounts to 30 per parish.
In terms of having persons volunteer, of course, we need more mentors. I still have to put a call out for mentors, especially or primarily males. We need more volunteers who are males to apply as mentors to the Child Diversion Program, because our largest group of children which we receive to the office are males between the age of 15 to 17 years. We do have males in the program who are 18 to 19, 18 to 20 in some cases.
Ms. Carey was speaking at a recent JIS think tank. Mentors under the National Child Diversion Program are expected to assist in the rehabilitation process by providing support through guidance and supervision to the children. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.